So let's do this question. You can see 6-month-old boy presents with decreased growth. Okay, decreased growth. Pigmented retinopathy, hemolytic anemia, peripheral neuropathy. You suspect that these signs are result of vitamin deficiency. Which of the following is most likely responsible for this patient's symptom? Good. So many people answered this question. So this is what we call is, this is the problem of abetalipoproteinemia. This is abetalipoproteinemia. So while you can see what is the cause, you can see carefully, understand carefully, decreased growth. So growth is decreased. Pigmented retinopathy is there. Hemolytic anemia, peripheral neuropathy. So neuropathic, hemolytic anemia, retinopathy, neuropathy, retinopathy, hemolytic anemia, and decreased growth. These are the presentation you can see here in this patient. Okay. You can see. So this is because of deficiency of this protein. Disorder of MTTP. This is because of problem in this MTTP. So what does this MTTP do? You can see this is digestion. Digestion happens by lipase, colipase, phospholipase, and then cholesterol esterase. So this will digest this micelle, and then after digestion, monoacylglycerol and digest this fatty acid, phospholipases. This all lipophosphatidylic acid, and then this fatty acid, this will be absorbed through passive absorption, you can see. And after absorption, this all will be actually reassembled in the endoplasmic reticulum. This will, now you can see, triacylglycerol will be formed, and this triacylglycerol will have to be loaded in the B48, and this loading is done by MTTP protein. If it is not loaded, it will not be excreted. So that is why here comes the function of MTTP. If MTTP is not there, mutated, there will not be loading, and if there is no loading, no secretion. So what will happen ultimately? This lipid may be digested, but it will not be absorbed. It will not be absorbed because it is passive absorption. If enterocyte has enough lipid, the lipid will not be absorbed, and lipid will go into the stool. It will appear in stool, and this is the condition. It's called steatorrhea. So lipid in stool, fatty stool. So this is the cause. Because of this, fatty stool will happen. So this is the presentation you will see in this patient. This is a type of malabsorption of fat. But what will be the problem to the patient? You know, the lipids, many lipids are important lipid. You can see vitamins, fat soluble vitamins. So these fat soluble vitamins will not be there in blood because these are essential lipid. Fat soluble vitamins are essential lipid. Now essential lipids are omega-3, linoleic acid and linolenic acid, alpha linolenic acid. This is omega-6 essential fatty acid. This is omega-3 fatty acid. This essential fatty acid will not be absorbed. And you know, if these are not absorbed, you know, your lipid has very vast amount of function. Everything is made up of lipid. Your RBC is made up of lipid. RBC is lipid. Membrane is lipid. So if lipid is absent, hemolysis will happen. Your neuron cells will have myelin. Myelin is nothing but lipid. So demyelination, that is why neuropathy. You can say because of myelination has problem, that this will cause peripheral neuropathy. Then because this vitamin A is deficient, vitamin A deficiency will cause actually loss of rod cells and cone cells. Rod and cone cells. This rod cells and cone, loss of rod cell and cone cells will cause pigmented retinopathy. This is very important. Pigmented retinopathy is a very classical picture of few disorders. One of these is abetalipoproteinemia. And then decreased growth. When lipid is not there, lipid is required for cell. No lipid, essential lipid. I am talking about essential lipid. No lipid, because non-essential lipid can be formed in the cell. But if there is no essential, no cell functioning. If no cell, good cell function, no growth. No growth, even no growth of body, no growth of brain. Mental retardation will be there. Stunted growth will be there. So this decreased growth will be there. This pigmented retinopathy, hemolytic anemia, because RBC also requires lipid. And then peripheral retinopathy. You know what is peripheral retinopathy? This, what will happen in peripheral neuropathy? This myelin. Myelin is lipid. And because of this because this myelin is deficient, that is why this will cause peripheral neuropathy. So these are the problem you will see because of deficiency of this lipid. Because of deficiency of this lipid. You got that? MTTP. MTTP.
Yes, sir.
Okay. MTTP. M for microsomal triglyceride transfer protein, MTTP. So you can see these are the presentation, you can see yourself. Microsomal, because microsomal means endoplasmic reticular. Triglyceride transfer protein. TAG transfer protein. So this is MTTP. And this is autosomal recessive disorder because of decrease in chylomicron VLDL. So, you know, this MTTP is not only present here, even in liver. In liver, the same protein MTTP is required. So even liver synthesizes this protein, there will not be transportation of normal lipid as well. Saturated fatty acid, other fatty acid as well from this liver as well. So liver will not actually, the lipid will not come. So actually whole body will have lipid deficiency. MTTP is not there in liver as well. So this will cause malabsorption. You know, I told you why malabsorption. Lack of these vitamins, lack of this vitamin will cause a problem in brain and other tissue. You can see ataxia, dysarthria, peripheral neuropathy, and then vitamin E deficiency will cause this hemolysis. So hemolysis mainly related to vitamin E deficiency and other fat deficiency also. What happens in vitamin E deficiency? If vitamin E actually protect membrane of RBC. If this vitamin E is not there, there will be homolysis. Homolysis is mainly related to vitamin E. So through this, I'm also teaching you actually vitamin deficiencies. What will be the causes of vitamin? So vitamin E is related to hemolysis. Vitamin D is related to bone. So kyphosis, kyphoscoliosis, lordosis, pescabum. These are the presentation because of vitamin D deficiency. This calcium deficiency will relate to this presentation. Motor tics, nystagmus, muscle related problem. And this vitamin K deficiency, we can say have difficulty forming blood clots. So clotting problem. Pigmented retinopathy because of vitamin A deficiency. Just remember this, through this abetalipoproteinemia, you will be able to study many deficiencies. All fat soluble vitamin deficiencies you'll able to study. So that is why this abetalipoproteinemia is very important. So how would you diagnose this condition? You diagnose this condition through various laboratory tests. You do blood test for lipid panel. You do vitamin A, vitamin E, vitamin K. You do so liver enzymes, because liver will also be affected. Okay, there will be lipid deposition also in liver, high lipid in liver, but blood will have less lipid. Okay, less triacylglycerol. So this is how you can find out from blood, from liver, there will be liver enzyme, elevated liver enzymes, and then vitamin K, because of deficiency, there will be prothrombin time will be elevated in blood testing. So test for anemia, you will do anemia profile. You check hemoglobin, you check the serum iron, and then MTTP actually can be analyzed from incisional liver biopsy. The stool smear will show staturia. And what would you do? How will you treat this? Restriction of long chain fatty acid, large doses of oral vitamin E. So these are the treatment you can see. So in such condition, diagnosis is very important. If you can diagnose the condition, you will be able to actually manage this condition, not completely treat this condition, but you will be able to actually alleviate many problems of this condition. So you can say this is called scoliosis, and this is kyphosis, okay? And this is the pes cabum. So you can see this arched feet is called pes cabum. And this is retinitis pigmentosa, loss of rod cells and cone cell from retina. These are malabsorption syndromes. Just see, these are malabsorption syndromes. So because of lack of absorption of this lipid, this syndrome will happen. For example, you can see if there is problem in digestion because of lack of digestive enzymes. So this will also cause malabsorption syndrome. So very famous example you must know is cystic fibrosis. Cystic fibrosis causes malabsorption. And then other disorders of absorption, when there is problem in epithelium has problem, loss of epithelium because of any of the problem. The disorder, you can see celiac disease. These are very important actually disease. Celiac disease, Whipple disease is malabsorption, and tropical sprue. These are important disorder. But I am focusing on this because I have taught you amyloidosis. That is why I am focusing on this, because people will not focus on this. So amyloidosis can cause absorption problem, transport problem, abetalipoproteinemia. Because of transportation does not happen, this will cause malabsorption. And then pernicious anemia because of blocked lactate. Also pernicious anemia, we will talk in detail about pernicious anemia in vitamins. So because of this deficiency in intrinsic factor, it will cause malabsorption of vitamin B12. Okay, here you will not see steatoria, but vitamin B12 deficiency happens because of lack of transport protein. Blocked lacteal, if lacteals are blocked by lymphomas or tuberculosis, then fat malabsorption can happen. Biliary obstruction can cause fat malabsorption because bile is required for absorption. Cirrhosis, because liver produces bile salts. If cirrhosis happens, bile salts are not produced. If cirrhosis, bile salts are not produced, and then it will cause what? Steatoria. So these are the presentation. You can see clinical presentation of this malabsorption are diarrhea, chronic diarrhea, and steatoria. So steatoria is very important. This is hallmark for malabsorption. And you can see these are the very important disorders. You can see this is the snapshot from step 1 from pathology section, GI pathology. So you can see these are the disorders that are related to malabsorption. Celiac disease, lactose intolerance. We have already done this lactose intolerance. So pancreatic insufficiency, tropical sprue. So pancreatic insufficiency include cystic fibrosis. So understand this cystic fibrosis in detail and correlate this with this pancreatic insufficiency, okay, and malabsorption syndrome. I think you have already been taught in detail about the cystic fibrosis in genetics, okay. This is cystic fibrosis. I have also told you what protein is deficient in my class. These are the condition. Whipple, this is one of the bacterial infection. This bacteria is actinomyces. So it is actinomyces, a difficult type of bacteria to treat, a little bit difficult type of bacteria, actinomyces. It is similar to fungus, very close to fungus. Bacteria close to fungus. These are actinomyces. So this, because the name itself came from this actin, means ray. Actin means ray. Actinomyces group. This is called Trophirima whippeli, and this cause Whipple disease. Actually, this happens in old age patient. Okay, generally it happens in older age patients, and generally it happens in older age farmers. Okay, farmers. The disease actually is acquired from the soil. This is bacteria that present in soil. So this is Whipple disease, and these are the presentation. Periodic acid stain, you can see it will be positive. Macrophage in intestinal lamina propria will stain positive with pus, and foamy cells, foamy macrophages are there in lamina propria. So if you do the tissue section, you will get such macrophage. Now this celiac disease is because of gluten. Okay, and this is called gluten sensitive enteropathy, and this is autoimmune disease. Remember, this is autoimmune disease. So in such patients, you avoid gluten diet. That is, gluten is present in wheat. You avoid that gluten. You suggest this patient gluten-free diet. And this is an autoimmune disease. What are the findings? Blood findings, you can see immunoglobulin A and T. So these are the findings you can see. My purpose is to just highlight this disease. This is autoimmune disease, and this is because of gluten. Okay, gluten. So remember that autoimmune disease, gluten, and it falls into malabsorption syndrome. And this tropical sprue is very similar to the celiac sprue. This is called celiac disease and celiac sprue as well. This is very similar to that, but it happens in tropical patients, the patients of these islands we are residing in. So this is tropical sprue is very. So just memorize at least these 4 disorders. These are very important, and don't forget this also. If classification based on what problem, if digestion has problem, then also there will be, if absorption and transport, if any either of this has problem, there will be problem in actually there will be steatorrhea and malabsorption syndrome. Okay, so don't forget this also. These are important for biochemistry. When iron is absorption is not there, malabsorption of iron will cause iron deficiency anemia. Malabsorption of vitamin B12, you know, in pernicious anemia. And then even malabsorption of folate will cause anemia. Which type of anemia? Megaloblastic anemia, which is macrocytic. Here, bleeding, vitamin K and vitamin C deficiency will absorption in malabsorption of vitamin K and vitamin C will cause bleeding, bruising, and fatigue. And they can be associated with, you see, cystic fibrosis will have all this. And in cystic fibrosis patient, you can see all this presentation, manifestation. You can see all this manifestation. If this sprue lasts for many days, they can have this type of deficiency, micronutrient deficiency, because epithelium is not there. So corpopedal spasm because of calcium deficiency. This deficiency will lead to malabsorption, or deficiency will lead to this presentation. So iron means anemia, vitamin microcytic anemia, hypochromic microcytic. Vitamin B12 folate means macrocytic anemia. This vitamin K-C is because result vitamin K clotting factor, and this affect the blood wall, vessel wall. That is why this bleeding, bruising, fatigue. Carpopedal spasm is because of calcium magnesium deficiency. Edema is because of protein deficiency. Glossitis is because of this deficiency of vitamin B2, B12, folate, niacin, iron. So night blindness is because of vitamin A. So pain in limbs are because of sodium, magnesium, this mineral deficiency, calcium and vitamin D. Peripheral neuropathy is associated with this disorder, vitamin B1, B6 and B12. Don't forget this. Peripheral neuropathy is very important. So whatever I have made bold, these are very, very important. Even this also.